But even if someone is not experiencing low testosterone symptoms, and you find randomly these low testosterone levels like 250, 300, health-wise, wouldn't it be better to bump those up to 600, 700
I
for
mean,
longevity and health reasons
there
for their
definitely would be
hormones?
cardiovascular benefits for sure. Yeah. So because we know that there's an association with being hypogonadal and having an increased risk of deleterious cardiovascular events, and also an increased risk of neurological events such as dementia and Alzheimer's and things are associated with low. So yeah, I can see the argument for it, but I guess that has to be context specific. If you've got a young male who's yet to have a family, who's 25 and he's an entrepreneur and he's very muscular, going to the gym, and he just happens to have bloods that are 250, 300 total T, then you could argue maybe you've got time to wait for him to finish having his family and things if that's in his plans, and then look at it again later. But yeah, I think it's very context specific, and you need to look at what the actual picture is with each patient at the time.
Mm-hmm.
And like I said, those reversible causes are really, really, really important. And sometimes you won't necessarily know the reversible causes, but they might be the ones that you kind of want to say, let's recheck again in 3 months or 6 months or whatever as well. Give them the information, because with all of this stuff with testosterone deficiency, it tends, like I always say, this is a marathon, not a sprint. We don't need to start it off straight away. Taking that time to talk about things if you're in a relationship as well, so that you can talk it through with them, so you can make those big decisions that you kind of feel like you're almost being forced into doing super quickly. But yeah, absolutely, Stephen, you make a really good point. Even if you're not necessarily symptomatic with that testosterone deficiency, it's still worth considering all the other things that Felix rightly pointed out that you can prevent, even from a sort of a metabolic picture as well, sort of metabolic syndrome, and thinking about, again, body composition and fatigue and mental health as well, which is really important. So if your numbers are low but you feel okay, you might want to choose to monitor it for a bit and see how things go, check out the reversible causes process, and then go from there. That would probably be my
something
advice.
as simple like, we've seen this before, like something as simple as someone constantly being in a caloric deficit to maintain a level of leanness will make them hypogonadal. And as soon as you start eating maintenance calories / a little bit more, your testosterone normalizes.
Shift workers who are doing night shifts or really long shifts and things like that. It can be a post-viral, post-viruses, post-COVID and things. It can really kick around and ditch the testosterone for quite a long time. So there's so many variables that can impact it. And I think the British Society for Sexual Medicine recommend at least 2 blood tests, sort of proving low by their standards TRT. Before providing TRT. And I think that's really, really important, because it's a snapshot. You can take it different times of the day and you'll get different pictures. But if the only phlebotomy appointment someone can get is post 7 night shifts on the trot, then actually it may well be low anyway.
He just added, I have chronic insomnia, a big belly, and osteoporosis. I have an appointment with an endocrinologist on Tuesday.
Okay. Yeah. I mean, yeah. So take the guidelines with you to speak to that endocrinologist, because there's not all endocrinologists created equal, is probably a way of putting that. Like, some people that have specialist interests in TRT will be good, but if they don't, then it may be an uphill battle. But yeah, just make sure you're well informed.
Yeah, I think they seem to run by a different set of thresholds for treatment. So, like I said, we generally run at Eden Clinic. We run through the British Society for Sexual Medicine, and you can actually Google their guidelines, and they give you the treatment thresholds for both free and total testosterone. I hope that's helpful.
Probably when you go the insurance way, they will only look at numbers, and if you're not low enough, you won't get treatment, right?
Yeah, that's certainly going to be a factor for sure. If you use health insurance, then health insurances are businesses and they want to make money rather than give it out.